Ashley and this is my Maternity Passoff. I'm going to go ahead and knock on the door, close it behind me, introduce myself. Hi, my name's Ashley and I'm your nurse for today. I'm doing some hand hygiene. I'm going to go ahead and just verify the name on your ID band. Can you tell me your first and last name and date of birth? Perfect, I see that matches, thank you. All right, well, congratulations on your baby. I'm just here to do an assessment. Great. So in order to start out today, I'd like to go ahead and just get some vitals. Is that okay? Perfect, thank you. So I'm going to go ahead and get her temperature, her blood pressure. If her temperature is 100.4 or more, I'm going to go ahead and notify the provider. We'll get her pulse, respirations, all of the things. So we're going to go ahead and just do that. And after I've done your vitals here, we're going to go ahead and just start doing an assessment. Is it okay if I look at your breasts today? Perfect, thank you. So I notice you're breastfeeding your baby. I don't see any signs of redness, inflammation. Do you have any pain or tenderness that comes with that? No, perfect. And we did a latch score earlier. Your baby scored a 10. They really are quite amazing. They're feeding well. They're able to put it in the correct position, and you've got some great holding positions for your baby. So I don't see any signs or concerns of that. So now I'm going to go ahead and just listen to you. Is that okay? Perfect. So before I do, I'm going to go ahead and just assess your lochia, which is down here. I'm just looking at your bleeding. We're going to look at the color, characteristics, make sure there's no clots or anything like that. Is that okay if I look at that? Perfect, thank you. Okay, I do see your bleeding there. I do see it looks moderate. I don't see any signs of clots. I don't see any like hematomas or anything like that when I'm looking at you as well. Everything is looking normal with that. So we'll continue working our way down as we do our assessment. So I'll start by listening to your heart. So I listen to the heart. Okay, and then I'm just gonna go ahead and listen to your lungs. If you can just breathe in each time. Perfect. Great, and then I'd like to listen in the back as well, if that's okay, if you can just sit up. Breathe in, in. Perfect, and I'm gonna go ahead and just listen to your stomach, is that okay? Great. And I'm listening to the stomach and the bowel sounds. Perfect. Now that I listen, I'm going to go ahead and just massage your fundus here and just kind of see where everything is at. Alright, well, getting that supported, I do see that it is at the level of the umbilicus. It feels firm. I don't see any issues with that. Do you have any pain in your abdomen or pain anywhere in general? Okay. Alright, great. And if you did have any pain, I'd ask you about caldera, the characteristic onset, location, duration, exasperation, radiation, things that make it worse. So we would go over your pain with that. What about your bowels? Have they started to wake up a little bit? Have you had a bowel movement yet? No? Okay. I do see that we have you on a stool softener. We're taking that regularly. I would educate you to take it regularly and consistently. Here at the start, you know, we want to make sure that we can provide you as much pain relief as possible, and getting constipated isn't fun on top of having a baby. So we'd go ahead and just make sure you're taking that regularly. We'd also want to educate about staying on top of your pain as well. Let us know if you're feeling anything. Way to educate about your bleeding. If you notice any clots or like a sudden rush of blood or anything like that, you let us know. We'll be here to help you with that. So now I'm gonna go ahead and just get like a little kit for you to provide some pain relief down there with some ice. So I'll get that. But while I do, how have you been able to pee okay? Has there been any issues or pain with that? No? show you this. This is gonna be your best friend for a while. This is an ice pack, and here's a pad. So you just put this in your underwear and you put your pad on top. And we've got these witch hazel pads, and you just line them up here on the top of the pad. There's like 4 or 5 of them that you can put on there, and then you spray this on there, and then you're gonna keep that in your underwear. It's gonna provide you some relief as you're recovering. So you can just put that right here. Perfect. Okay. And now that we've put that there, I did want to educate as well about our peri bottle. We don't want you wiping and causing any more trauma to the area, so we'd like you to put some warm water in here, and as you're going to the restroom, just use this. If you are wiping, it's good to wipe front to back as well, but make sure that you're using this whenever possible. So I'm gonna go ahead and just assess your legs here. You were able to get up and ambulate and everything like that, so you were looking good when you were walking to the bathroom earlier. I don't see any redness or thrombosis or anything like that. There's no pain or tenderness here, and no swelling, but we'll continue to watch for that, and if you see anything, please let us know. So we've done all of that. We did your latch score earlier. Your bleeding, we went over your Rita and what we were looking for. I'm trying to think if we forgot anything else. I think that's it. But here's your call light. If you need anything, feel free to call us. I just educate with your baby. Don't let anybody take your baby that you don't know. And just make sure you're consistently feeding them like every 2 to 3 hours. Let us know if they are showing any signs of like excessive tiredness, or if you feel like they're cold. We'll be monitoring your baby closely as well with you, but just let us know, and that will do it.